Women's longevity clinics, hormones, bone health, and midlife programs by Price, and program snapshot checked July 27, 2026. Midlife health is more than hot flashes. Menopause can affect sleep, mood, vaginal comfort, bone strength, blood pressure, cholesterol, blood sugar, and heart health. That is why more women are looking for menopause clinics and women's longevity programs. These services range from low-cost virtual visits to concierge memberships that include lab work, medication, and imaging. But the word longevity does not guarantee complete medical care. A program may offer hormone therapy, but not bone density testing. Another may include blood tests, but no pelvic health support. A third may advertise a low monthly price while charging extra for medication, scans, or follow-up visits. This guide compares public pricing, monitoring plans, imaging options, pelvic health support, and safety practices. Important note: prices and services can change. Medication, laboratory, imaging, insurance, and pharmacy costs may be separate. This article is for education and is not personal medical advice. What a complete midlife program should cover. A strong program should look at 5 areas: menopause symptoms, hot flashes, night sweats, sleep problems, mood changes, fatigue, and brain fog. Hormone treatment. This may include systemic estrogen, progesterone when needed, or local vaginal estrogen. Hormone therapy should be matched to a person's symptoms, medical history, uterus status, and personal risks. Bone health. Estrogen loss can speed bone loss after menopause. A bone density scan, called a DEXA or DXA, may be needed at age 65 or earlier when fracture risk is high. Heart and metabolic health. A good program should review blood pressure, cholesterol, blood sugar, weight, smoking, exercise, sleep, and family history. The menopause transition is an important time to check these risks. Pelvic and sexual health. This includes vaginal dryness, painful sex, urinary symptoms, pelvic pain, prolapse, and pelvic floor muscle problems. Virtual care may help with medication, but some problems need an in-person pelvic exam or pelvic floor physical therapy. A simple example. Imagine Maya, who is 52. She has hot flashes, high blood pressure, painful sex, and a mother who broke her hip at age 70. A basic hormone subscription might help with hot flashes. A more complete plan would also check Maya's blood pressure, cholesterol, blood sugar, fracture risk, breast screening, vaginal symptoms, and family history. She may need a DEXA scan or a referral to pelvic floor therapy. That is the difference between symptom treatment and whole-person midlife care. Price snapshot. From virtual visits to concierge care. The table below uses public prices listed by clinics. It does not include every possible medication or test. For the full table, please open this article on longevityfit.life. Clinic profiles. MIDI Health. Best insurance-based virtual option. Published price. MIDI lists a $250 initial self-pay visit and $150 continued care visit. Patients using insurance pay their plan's normal copay, deductible, or coinsurance. MIDI says it is available in all 50 states and works with many major preferred provider plans, but it does not currently treat Medicaid patients and is not covered by Medicare. What it covers. MIDI offers treatment for menopause and perimenopause symptoms. Plans may include FDA-approved hormone therapy, non-hormonal medication, lifestyle guidance, nutrition and exercise support, sexual wellness care, lab orders, and health screenings. The clinic says its first visits are usually longer than a rushed primary care visit, with a 30-minute initial visit and shorter follow-up visits. Monitoring cadence. Follow-up visits are scheduled when symptoms need review, medication needs adjustment, or a new concern appears. The clinic also says it orders laboratory or screening tests when needed for safe prescribing. Imaging and pelvic care. MIDI's public pages discuss screening orders, including mammograms and laboratory work, but do not show a standard DEXA scan package. Patients should ask whether the clinic will order a DEXA and who will review the results. Because visits are virtual, pelvic exams and pelvic floor therapy usually require local care. Best fit. MIDI may work well for a woman who has insurance with a participating plan, wants a menopause-trained clinician, needs medication and general risk screening, already has a local primary care or gynecology team for exams and imaging. Genev. Best for doctor and nutrition support. Published price. Genev lists a $250 self-pay initial doctor visit and a $199 follow-up. Its registered dietitian visits cost $199 for the first visit and $119 for follow-ups. Genev says its video care is available in all 50 states and is covered by some Aetna, Anthem, and United Healthcare plans. What it covers. Genev uses a team approach with menopause-trained doctors, registered dietitian nutritionists, nutrition and fitness advice, sleep and mood support, hormone and non-hormone treatment, weight and metabolic health care. The clinic's weight program lists a 50 to 55-minute dietitian intake, a 30-minute doctor visit, metabolic labs at intake, and repeat labs every 6 months. If medication is prescribed, the program lists at least 2 doctor follow-ups each year. Monitoring cadence. The clearest published schedule is for weight management. Dietitian support may include 6 visits over 3 months. Metabolic labs are checked at the beginning and about every 6 months. Medication patients have at least 2 doctor follow-ups each year. Menopause patients should ask whether the same schedule applies to hormone therapy. Imaging and pelvic care. Genev's public pricing page does not list a DEXA scan or pelvic floor physical therapy as part of the base package. A patient may need a local order for imaging or a referral for pelvic care. Best fit. Genev may be a good choice for women who want more than a prescription, especially those working on weight changes, blood sugar, nutrition, exercise, sleep, long-term lifestyle habits. Electra Health. Best for coaching and education. Published price. Electra lists a $249 cash price for the initial visit and $149 for follow-up visits. Coaching costs $99 per session when insurance does not cover it. In-network patients may pay only their normal specialist copay or coinsurance. What it covers. Electra combines virtual visits with a board-certified clinician, menopause education, prescription treatment when appropriate, laboratory orders, one-on-one coaching, online community support. The clinic says it uses FDA-approved hormonal and non-hormonal medications and does not prescribe compounded or non-FDA-approved medications. It also says it does not use saliva or urine hormone testing because those tests are not evidence-based for routine menopause care. Monitoring cadence. Electra advertises ongoing follow-up with both a clinician and a coach. The exact number of visits depends on the patient's plan and insurance coverage. Imaging and pelvic care. Electra's provider information clearly states that some care, such as a pelvic exam, cannot be done online. The clinic refers patients to local providers when in-person care is needed. Its public cash pricing does not list DEXA scans or pelvic floor therapy as included services. Best fit. Electra may suit women who want more education before choosing treatment. Coaching between medical visits. Help with sleep, mood, sex, and hot flashes. A virtual menopause specialist plus a local primary care doctor. Alloy. Simple cash pricing for medication-focused care. Published price. Alloy lists a $49 one-time consultation fee. Its estradiol patch starts at $74.99 per month. Billed as a 3-month supply. The clinic says the consultation includes unlimited doctor messaging, and the medication is shipped at no extra delivery charge. What it covers. Alloy focuses on perimenopause and menopause treatment, FDA-approved estradiol products, progesterone when needed, vaginal estrogen, and other menopause treatments. Messaging with physician providers. Alloy says its clinicians are board-certified physicians and menopause experts. Monitoring cadence. Alloy emphasizes online intake, physician review, and messaging. Its public pages do not clearly list a standard schedule of video follow-up visits. Patients should ask, when will the first medication review occur? Is a scheduled video visit included? Who reviews blood pressure and new symptoms? How are abnormal bleeding or side effects handled? Imaging and pelvic care. No DEXA scan, mammogram, pelvic exam, or pelvic floor therapy is listed as part of the base price. This means a patient may need a separate local care team. Best fit. Alloy may appeal to someone who wants a clear cash price, prefers FDA-approved medication, does not want a monthly membership fee, and already has a primary care or gynecology provider. Winona. Low-friction care with medication shipped home. Published price. Winona lists an estrogen patch from $149 per month. Its public treatment list also shows progesterone capsules from $39 per month, estrogen cream from $89 per month, and other products at different prices. A patch plus progesterone would therefore start near $188 per month before adding other treatments. What it covers. Winona offers online medical evaluation, hormone treatment, free virtual doctor visits and follow-ups, unlimited messaging, home delivery, HSA and FSA payment options. Winona does not bill insurance directly. Monitoring cadence. Winona says a doctor checks in at about 10 weeks to see whether the dose or treatment method should change. Imaging and pelvic care. Winona's public pages do not list DEXA scans, heart risk testing, or pelvic floor services in the base price. Patients should keep a local provider for mammograms, blood pressure, blood sugar, cholesterol, and pelvic concerns. Safety point. Winona says it does not require blood or saliva hormone testing before prescribing for typical menopause symptoms. That is consistent with ACOG guidance, which says hormone testing is usually not useful before starting hormone therapy for common menopause symptoms. However, Winona also offers compounded treatments. ACOG says compounded hormone therapy should not be used routinely, when FDA-approved options are available. If compounded treatment is chosen, the patient should receive clear information about its lack of FDA approval, possible dosing problems, and other risks. Gaia Wellness, concierge hormone care with limited state access. Gaia's public pages show more than one plan menu, which makes written price confirmation important. One current hormonal agency page lists $299 for a one-time focused visit, $297 per quarter for Agency RX, $567 per quarter for Agency Plus, $897 per quarter for Agency Total. The same page says monthly plans are also available. A separate Gaia membership page lists a $299 monthly core plan with up to 2 imaging scans and a $579 monthly hormone plan with quarterly laboratory work. What it covers. Gaia advertises physician-led hormone care, lab ordering and interpretation, medication titration, symptom tracking, possible testosterone treatment when clinically appropriate, hormone, metabolic, and lifestyle support. The core plan page lists up to 2 scans, such as a mammogram, DEXA, or ultrasound if needed. This is one of the few public clinic pages that clearly mentions imaging as part of a package. Monitoring cadence. The public pages describe monthly or quarterly medication rhythms and laboratory monitoring. Patients should ask whether the laboratory fee itself is included. The hormonal agency page says lab orders and physician interpretation are included, but laboratory charges may be separate unless insurance covers them. Safety screening. Gaia says its clinicians review factors such as menopause timing, uterus status, bleeding history, blood pressure, blood clot history, migraine history, breast screening, metabolic risk, and family history. That is the type of risk review a hormone program should explain before treatment begins. Regional limitation. The hormonal agency page currently lists service in Florida, North Carolina, Virginia, Indiana, and Tennessee. This is a clear example of how state licensing can limit access even when care is virtual. Long Life Med, broad longevity membership. Long Life Med's women's program lists plans from $300 per month, $900 per quarter, or $1,500 for 6 months. The public page advertises hormones as needed, an annual physical, annual laboratory work, follow-up labs, EKG, breathing tests, weekly provider support, and body composition analysis. Monitoring cadence. The listed monitoring plan includes follow-up testing at 6 weeks, more monitoring every 3 to 5 months, annual physical examination, annual laboratory testing, weekly provider support, imaging, and bone health. The program advertises body composition information that includes bone mass. This is not automatically the same as a clinical hip and spine DEXA used to diagnose osteoporosis and estimate fracture risk. That distinction matters. A wellness body scan can be interesting, but it should not replace medical bone density testing when clinical guidelines indicate a DEXA. Safety point. The page mentions injections, creams, and pellet procedures. Patients should ask whether the proposed treatment is FDA approved, compounded, or implanted. They should also ask how the clinic protects the uterine lining when systemic estrogen is used by someone who still has a uterus. This model may offer convenience, but the broad phrase, all hormones as needed, deserves a detailed medical discussion rather than an automatic promise. University of Michigan Menopause Clinic. Academic and multidisciplinary care. The University of Michigan Menopause Clinic is a useful example of an academic care model. Its public page describes connections with nutrition, sexual health, cardiovascular risk assessment, mammography, and pelvic floor physical therapy. It does not list a single public package price. This type of clinic may be especially useful for women with complex medical conditions, pelvic pain or urinary problems, a history of cancer, early menopause, osteoporosis, heart disease risk, difficult medication side effects. The trade-off is that costs depend on insurance, referrals, visit length, and the services used. How safe HRT screening should work. Start with medical history, not just a hormone quiz. A clinician should ask about breast or endometrial cancer, stroke or heart attack, blood clots, liver disease, high blood pressure, migraine history, smoking, medicines and supplements, pregnancy possibility when relevant, menstrual and bleeding history, uterus status, family history. ACOG says systemic hormone therapy is usually not recommended for people with a history of breast or endometrial cancer, stroke, heart attack, blood clots, or liver disease. This does not mean every person with a complex history has no options. It means the decision may require a specialist and careful coordination. Match estrogen with uterus status. A person who still has a uterus usually needs progestin or progesterone with systemic estrogen. Estrogen alone can make the uterine lining grow and increase the risk of endometrial cancer. A person who has had a hysterectomy may be able to use estrogen alone, depending on the medical situation. Do not confuse more testing with better care. For common perimenopause and menopause symptoms, ACOG says routine hormone testing is usually not needed before starting treatment. Hormone levels can change greatly during the transition. Treatment is usually based on symptoms, menstrual changes, health history, and risks. This does not mean that all laboratory testing is useless. Blood tests may be helpful for thyroid problems, anemia, diabetes, high cholesterol, liver disease, kidney disease, unusual or early menopause, other conditions that can look like menopause. The key question is, will this test change the treatment plan? Check bone health at the right time. The United States Preventive Services Task Force recommends osteoporosis screening for all women age 65 and older, and postmenopausal women younger than 65 who have increased fracture risk. ACOG also lists family history of hip fracture, low body weight, smoking, high alcohol use, certain medications, and some medical conditions as risk factors. A DEXA scan does not always need to be repeated every year. The timing depends on the first result, age, treatment, and fracture risk. ACOG notes that DEXA may be used 1 to 3 years after treatment begins when the clinician needs to check progress. Review heart risk without selling HRT as a heart cure. Heart health screening should include blood pressure, cholesterol, blood sugar or hemoglobin A1C, weight and waist measurement when useful, smoking, exercise, sleep, family history, and kidney health when relevant. The American Heart Association lists blood pressure, cholesterol, blood sugar, body weight, diet, exercise, sleep, and nicotine exposure as key heart health measures. Hormone therapy can be very helpful for menopause symptoms. It is not a guaranteed anti-aging treatment, and it should not be sold as a general cure for heart disease or as a promise of longer life. The FDA lists approved uses, such as treating moderate to severe hot flashes, vaginal symptoms, and preventing bone loss for certain products. Treat pelvic health as real health. Low estrogen can cause vaginal dryness, painful sex, burning, urinary discomfort, and more frequent urinary tract infections. Local vaginal estrogen or other treatments may help some patients, but medication is not the whole answer. Pelvic floor physical therapy can help with urine leakage, pelvic pain, pain during sex, muscle weakness, muscle tightness, prolapse symptoms, recovery after pelvic surgery. A virtual clinic should have a clear referral plan for these problems. Monitoring cadence, what is reasonable? There is no single schedule for every woman. A practical plan often includes, before treatment, medical and medication history, risk review, blood pressure, breast screening status, uterus and bleeding history, bone and heart risk review, laboratory tests when medically needed. After starting or changing treatment, a follow-up in about 6 to 12 weeks, review of symptom improvement, review of bleeding, breast tenderness, headaches, mood, and other side effects, dose or route changes when needed. For example, Winona advertises a 10-week check-in, while Long Life Med lists 6-week testing, followed by checks every 3 to 5 months. Each year, ACOG recommends discussing whether to continue hormone therapy every year. The decision should consider symptoms, benefits, risks, age, health changes, and personal preferences. FDA rules, compounded hormones, and informed consent. The February 2026 FDA label change. On February 12, 2026, the FDA approved labeling changes for 6 menopausal hormone therapy products. The changes remove statements about cardiovascular disease, breast cancer, and probable dementia from the most prominent boxed warning for those products. However, the FDA did not say that hormone therapy is risk-free. Important risks remain in the prescribing information. The boxed warning for endometrial cancer also remains for systemic estrogen alone products. The FDA also added information that may help women younger than 60 or within 10 years of menopause consider treatment when symptoms are significant and there are no major contraindications. FDA-approved and compounded are not the same. FDA-approved hormone products are reviewed for safety, effectiveness, quality, dose, and labeling. Compounded drugs are not FDA-approved. The FDA does not review them before marketing for safety, effectiveness, or quality. Compounding may be useful when a patient has a real medical need that cannot be met by an approved product, but it should not be treated as automatically safer or more natural. Informed consent should clearly explain what the treatment is meant to help, what benefits are likely, what risks are known, what alternatives exist, whether the product is FDA approved or compounded, why progesterone is needed when a uterus is present, what follow-up is included, what tests or imaging cost extra, what symptoms require urgent medical attention, how the clinic will share records with the patient's primary care provider. A woman should never feel rushed into a hormone package because a sales page calls it optimization. Access gaps across the United States. Insurance does not always mean affordable care. Kaiser Family Foundation reports that about 90% of women ages 19 to 64 had health coverage in 2024, but 1 in 10 remained uninsured. Coverage also does not guarantee a low-cost specialist visit. Deductibles, network rules, medication coverage, and laboratory fees can still make care difficult to afford. The clinic examples show the divide. MIDI and Genev may cost less for patients with participating insurance. Alloy and Winona offer simpler cash access, but do not bill insurance in the usual way. Electra accepts some insurance plans, but has higher cash visit prices. Gaia serves a limited number of states and uses concierge pricing. Academic clinics may offer deeper care, but require local access, referrals, and insurance navigation. Rural areas face a double barrier. A woman living far from a menopause specialist may find virtual care easily, but she may still need to travel for DEXA scanning, mammography, pelvic examination, pelvic floor therapy, cardiology care, gynecologic ultrasound. This creates a local access gap. Virtual care can remove the travel barrier for conversation and prescriptions, but it cannot remove the need for every physical service. Training is still uneven. The best national data on menopause training are older, but they show a clear concern. In a survey of United States obstetrics and gynecology residents, many reported needing more education in hormone therapy, bone health, cardiovascular disease, and metabolic health. About 68% wanted more education on hormone therapy, 66% on bone health, and 72% on cardiovascular disease. A later survey of family medicine, internal medicine, and obstetrics and gynecology trainees also found important gaps in menopause management knowledge. This helps explain why many women turn to specialty clinics after being told that their symptoms are just aging or that their laboratory results are normal. How to choose a clinic by budget. If you have insurance, start with MIDI or Genev if they are in-network. Ask about specialist copays, deductible requirements, medication coverage, laboratory costs, DEXA coverage, referral rules. If you want low-cost cash care, Alloy may offer a simple entry price for medication-focused care. Winona may be convenient, but add the cost of every medication and confirm whether the treatment is FDA approved or compounded. If you want coaching and education, Electra may be a better fit if you want a clinician, health coach, education, and community support. If you want labs and imaging in one membership, Gaia and Long Life Med represent concierge models. They may be useful for people who can afford membership pricing, but patients should confirm exactly which laboratory, medication, and imaging costs are included. If you have complex pelvic, heart, or bone concerns, consider an academic menopause clinic or a local gynecologist who works with cardiology, endocrinology, pelvic floor physical therapy, and primary care. 10 questions to ask before paying. Is the clinician board certified and trained in menopause care? What is the total first-year cost, including medication? Are follow-up visits included? How soon is the first medication review? Are blood tests required, optional, or medically targeted? Is the hormone product FDA approved or compounded? Who monitors blood pressure, cholesterol, and blood sugar? Can the clinic order and review a clinical hip and spine DEXA? What happens if I have pelvic pain, urinary leakage, or abnormal bleeding? Will the clinic send records and test results to my regular doctor? Conclusion: the best women's longevity clinic is not always the most expensive. It is the one that matches the woman's needs and clearly explains what is included. For one woman, that may be a $150 virtual follow-up. For another, it may be a multidisciplinary academic clinic with pelvic floor therapy, bone care, and cardiology support. A concierge plan may be useful when it truly combines medical oversight, laboratory work, and imaging. It may be poor value when it mainly sells supplements, repeated hormone panels, or vague promises about aging. A safe and useful program should do 4 things well: treat symptoms with evidence-based options, review bone and heart risks, offer a real plan for pelvic health, and explain costs, risks, alternatives, and follow-up before treatment begins. Midlife is not a problem to hide. With the right care team, it can become a strong starting point for better health, better movement, and a more confident future. All links to sources are available in the text version of this article. You can find the full article at longevityfit.life/blog. Thanks for listening. For more research-driven guides on fitness, longevity, health span, and healthy aging, visit longevityfit.life. That's longevityfit.life for the full written research.